Heidi's Live.
It is time now for our financial moment with Heidi, helping us make sense of the dollars and decisions that affect our everyday lives. And today, we're diving into something that can really catch people off guard: Medicare coverage. Many assume it covers everything health-related once you turn 65, but that's not necessarily the case. Heidi Hughes-Kemp-Collins is here to break down 5 surprising things Medicare will not cover, why it's so important to plan ahead for these potentially out-of-pocket costs. Heidi, welcome back.
Thank you. Good to be back.
Well, I love this topic for today. We've been doing kind of a series, or Heidi has, on Medicare and helping us better understand it, especially as people are electing health insurance right now. So it's very important. So 5 things that may catch people off guard or may be surprising. The first one, cosmetic surgery.
This is a tricky one because, you know, a person may feel that it's not cosmetic surgery that's necessary, but maybe the insurance company or the Center for Medicare would not agree. So as an example, some women need to get breast reduction surgery because they have just debilitating back problems. That's cosmetic surgery.
Is it?
And Medicare will not pay for it.
Okay.
So even though a woman is in just dire pain and just really has, you know, a debilitating condition, it's not paid for.
It's not paid for. Yeah, and I know that's, you know, with cosmetic surgery, that's oftentimes too something that you will run into with just any type of insurance company.
Right.
But it's important to note if, you know, you're starting Medicare. Another one, acupuncture. This is something that is incredibly helpful for a lot of people when it comes to pain management and inflammation and things like that.
It is. And, you know, people think, oh, well, my, you know, chiropractor is covered, you know, so my acupuncture should be covered. Because sometimes the same provider or maybe in the same office, you're receiving both services.
Yep.
But acupuncture is not covered.
That one is not covered either. Okay, this one I think is really going to surprise people: dental care.
Yes, here's the thing. You know, a lot of us have dental care through our employers, you know, and then we retire. And, you know, we go to our dentist for our, you know, semi-annual cleaning.
Right.
And we get a big bill. Yeah. You know, and a lot of us, I would say most of us, think that's very important care.
Right.
You know, but it's not. Medicare does not cover dental care.
Okay.
Now, you can buy a Medicare Advantage plan. We talked about these last time. This is Medicare Part C, also called Medicare Advantage.
I remember.
Good job.
We are learning with Heidi. Yes, Medicare Advantage.
And some of these do cover dental care, but you have to be really careful and make sure the dentist that you use is covered by that plan.
Yes, and that's, again, like there are people who, they do this, they will guide you through making these selections too when it comes to Medicare as well.
We do it at our office.
You do it at your office. Okay, so that is super helpful because you know what you're getting. Eye exams and glasses, that's also something. I mean, when you get it through your employer, like myself, for example, it does not go through my same health insurance. It is a separate health insurance. It is. So that makes sense.
But regular Medicare will not cover eye exams or eyeglasses. You know, and this is a big eye opener to a lot of people. You know, they're used to those medical expenses being covered.
Right.
And under Medicare, under regular Medicare, they aren't. Okay. Now, you may find, again, a Medicare Advantage plan that will cover those.
Okay.
But a lot of times the eyeglass portion, you know, that cost is capped.
Okay.
You know, again, you have to make sure that your, you know, obstetrician or, you know, your eye doctor is covered. Yeah. Okay. In that plan.
Okay. That's good information, good tools to have as you kind of begin this process, because then you know what to ask. Right. Sometimes things get left out because people don't even know that they should be asking about that, and then all of a sudden they find themselves without, and it's too late. Finally, and again, surprised by this one a little bit, hearing aids.
Hearing aids. Hearing aids are expensive.
Yeah, they are.
You know, and a lot of folks will get hearing aids before they retire, and then maybe they lose one. Right. Or, you know, maybe they need to adjust or something like that. Yeah. And they find out they're not covered. Yeah. And once in a great while, hearing, you can find, you know, maybe the The hearing exams are covered with a Medicare Advantage plan, but most often hearing aids are not covered, and they're going to run you several $1,000s. And a lot of people on fixed incomes, we're talking about seniors, don't have that in their back pocket.
No, absolutely not. And especially if it's something that you're used to getting through insurance and then all of a sudden you retire, it's something that you didn't think that you would lose, you know, perhaps again when you're not thinking about it. So wow, some eye openers there, no pun intended. I know we were talking about eyeglasses and eye exams. Heidi, thank you so much.
You're welcome.
And a reminder to everybody that Heidi and her team can help with short-term goals. They can help with Medicare selections as well as some major financial milestones. If you want to learn more, visit the website there on your screen. That is hhcinvestments.net. And of course, we would love for you to watch all of our segments together by visiting kwqc.com and clicking the tab for Quad Cities Live. Heidi, we appreciate it. Thank you.
Good to be here.
Yes.
Thanks.